Hello, my name's Moira Sinclair. I'm the Senior Charge Nurse in the Emergency Department here at the Balfour in Kirkwall. It depends on your symptoms. Currently with the COVID-19 coronavirus situation, there is general advice out there if you have a cough or a high fever, high temperature, you should not present to the emergency department, and we would ask you not to do that. We would ask you please to follow the national advice and to phone your GP or to dial 111, which is the NHS 24 out of hours service. We have a designated entrance at the Balfour, which is signposted, and that's where we would ask you to present to, and you would go to the main reception desk in the emergency department. They will ask you routinely whether you have a new cough or a fever, and if you do, certain measures will come immediately into place to protect the public who may be in the department, the staff in the department, and any vulnerable people who may be around. So that's why we need to minimise the attendance to the emergency department to people who need to come and see us. We are open, we are still operating as a service, but anybody who self-presents with a cough or a temperature is putting other vulnerable people at risk, and we would urge you please to contact your GP by phone or phone NHS 24 out of hours on 111 rather than come to the hospital. You can bring one person with you. We would advise that you don't take the whole family. If that's not possible because you've got children, etc., and you can't leave them at home, then please try to keep the number of people coming in with you to an absolute minimum of one person, and that would really only be if you need assistance with mobility or some means like that. Otherwise, please come in on your own. This is again to try and minimise the contact with others. Stay in the car for the rest of the family if possible. Don't go to the cafeteria for a cup of tea. Don't wander around the hospital is the advice that we're trying to get across. We advise you then just to go back home. Once you've been seen and you're allowed to go back home, follow the national guidance just for social distancing, etc. We'd just like to, this is difficult times for everyone at the moment. We appreciate that people are anxious at the moment, and we appreciate that sometimes you may want to come and see us for reassurance, but please just, we want to thank you very much for being mindful of the current situation, protecting our service, protecting the staff from exposure as far as possible, and following the guidance that's been given out. That helps us to maintain a service to help to treat the most appropriate people in the best way that we can.